Those are the 5 tips, and from there, if anyone has any questions, I'd be happy to answer those.
Fantastic. Thanks, Jonathan. The first question that I've come across here is actually about talking to your staff about these security measures. What's the best way to relay this information to your practice staff? Are there any good resources on information security? Should we call a staff retreat? What's the best way to get them on board?
I think a luncheon of some sort, or some physical meeting is by far the best way to go. If this is something that's sent in a memo or an email, it just does not sink in. You have to get someone that understands this pretty well to sort of present to the group and make sure that the entire group understands and answers questions, because everyone has a different piece of the puzzle and everyone's going to have a different understanding of how security will apply to their particular working environment. So you've got to be able to answer those questions for everyone individually so we can have a team effort towards security. It needs to be in person like that.
Okay. On the topic of the staff, the password managers that you mentioned, are they just for private use, or can they be used by multiple people in our practices?
So that's actually one of the greatest features of password managers. Once you set up a password manager for your practice, your team can coordinate passwords together. So if there's a login for a particular website that several people need to have access to, you can delegate access to those several people through the password manager and revoke access immediately whenever you decide. So it actually creates a much more collaborative environment for getting passwords between your teammates, and it saves a lot of time. You're not emailing passwords or going to look at some spreadsheet or whatever system you might be using now. Once you go to a password manager, you're going to save time like you wouldn't believe.
So how do we know that these password managers won't be hacked?
I sort of addressed that in the slide. What the password managers are doing is they are encrypting on the client side. And what that means is when you type in a password on your machine, it is encrypted immediately. And before it is ever synced to any cloud service or anything like that, is encrypted before it's ever sent. So even if the password manager was ever to be hacked, it doesn't matter, because the information that they store is all already encrypted. There is nothing for hackers to take because it's already encrypted. Now, there's other services. I'm trying to think of an example here. Let's not give any examples. There's some services that will store your files and emails and things like this where they have access to. Actually, we do have some examples. Let's say like Apple and Google. Apple and Google have access to your emails. If the FBI or someone requests access to those emails, Google will say, okay, we'll get those emails from your system, we'll give them to the FBI. With a client-side encryption system, there's no way for the vendor to ever have access to that data. It's encrypted before it even touches the cloud. And so from that standpoint, no one has access to the passwords other than you. It's as secure as any other system. In fact, is the most secure. I forgot the exact wording of it, but it's basically the most secure method of storage that is available today.
Great. Okay. I had quite a few questions here about communication with patients. So I'm going to jump into a couple of those. The first one is, what should I do if a patient contacts me via email? Should I just ignore it? Should I ask the patient to send the question via our EHR? Should I call the patient? What should I do in that situation?
Well, I think it sort of depends on each particular practice scenario. What may work for some may not work for others. I mean, obviously, if I'm a patient, I would love a phone call. Everyone would love that, but that's not going to work for every scenario. First of all, there's no reason the patient should ever have your email in the first place. If they don't have your email, there's no way for them to email you. So you shouldn't be giving out your email in the first place. You should be giving out your EHR information or whatever secure messaging system that you might be using, but you should not be advertising your personal email to patients. If somehow you do get something sneaking through, I think your best bet would be to simply not respond to that email and to respond to them some other way, for example, through a phone call, through a secure message, or whatever system that works for your practice, follow up that way, and simply make sure that the patient does know that you have responded, but not directly through the email.
So if the patient is in the office and you're asking them for like their social security number, for example, while they're actually physically in the office, is that a security issue?
My understanding is that, well, as far as a security issue, no. There's no disclosure there unless you have some recording device in the air or something like that that's picking up the sounds. Then no, that's not going to be a security risk. Obviously, if you have a video camera that takes audio, then that would be. But in the vast majority of cases, I can't imagine that would be any sort of security risk. Now, just to be clear on that, though, again, you're going to have to collect the information that you require, but if there is a way to keep the personal information separate from the health information, you can avoid a lot of the creation of PHI, and you can avoid a lot of the risk that comes with that PHI. So that's not saying that because they're in person, there's any sort of different risk there. It's just saying that the more you can keep that information separate, the safer you'll be in general.
Okay, thank you. So do you have a few security recommendations for laptop computers owned by the practice? What are some good safeguards for those laptops?
I suppose my biggest recommendation would be keep your device encrypted. It can't just be password protected. It needs to be encrypted, and it needs to be up to date. If you have a laptop that is old to the point that it doesn't have encryption, you need to find something newer. If you have one that has some sort of legacy software on there that you can't update to the latest version of Internet Explorer or something like that, you've got to find a way to keep it updated with the latest security, because it's not uncommon for me to see practices having to use older software and then they don't update their system because they're trying to keep using this old software. So keep your devices encrypted and keep them up to date.
This is an interesting question since we've been hearing quite a bit about the battle between the FBI and Apple. What are the implications for health records if the FBI gets access to smartphones? Wouldn't that make it easier for hackers to get access to other people's health records? Do you have any thoughts on that one?
Yes, that's actually one. I think a lot of Apple's argument in that case is that if Apple defeats their own security measures to accommodate the FBI's work to try to find terrorists or whatever they might be doing, that's great for solving that particular case. But in the end, hackers and people that have other motives are going to find those same security issues. And once those are found out by those with different motives, then that's going to make it much, much easier for them to exploit those to get everyone's medical records. And by the way, medical records are already the biggest target for identity thieves, but not only are they the biggest target, they are by far the most valuable. I think a stolen credit card today, it sells on the black market for like a couple dollars, and a health record and health records will sell for 50 or hundreds of dollars each record. So they're much more targeted and they're much more valuable. So once security is weakened, the whole thing is going to have to change again. So yes, the FBI can, if it does force Apple to break down security, can cause additional HIPAA risks through that in a roundabout way.
Great. Well, if we don't have any more questions today, we will just close it there. If anyone listening does have any more questions, feel free to contact us at Vanguard Communications. Many thanks to you, Jonathan, for your wonderful presentation. Everyone who registered for this webinar will receive an email with access to the recording of Jonathan's talk, as well as past webinars. If you've attended a Vanguard Communications webinar before, your password will still work for those recordings. So before we close, I wanted to remind everyone to take the survey following this presentation and sign up for Vanguard's newsletter. Also be sure to watch your emails for more information on our next webinar. So thank you again for joining us, and have a wonderful evening.